Hi, good morning, Mr. John. My name is Anthony, and I'm from the respiratory. I'm a respiratory care student from respiratory care department. Before I will start, can I move beside you, and I'm gonna check your vital signs and also check your ID band. Okay. So first, by the way, I'm going to do before going to the patient's room is I have to verify the patient's chart, verify the order, and then introduce myself. And then once I'm here, I'm going to assess the patient first by checking the vital signs and auscultate, and also I have to verify the patient's ID band just to be sure if it's the correct patient. So once I'm done, I'm going to proceed to the next step, which is I'm going to explain what I'm going to do inside. So by the way, Mr. John, so what I am doing here is I have an oxygen tank. So as you can see, this one is an oxygen tank. You can label this by its color, which is color green, and also there's a note being said it's oxygen. So by the way, this oxygen, just for you to know and also to the relatives here who are present, it should be put in a rack just to be secure so that it will not be fall down. And if in case like some situations like we're gonna put some oxygen tanks such as stalled cylinders, we have to put it beside you with a chain. And then another thing to note, this oxygen is non-flammable. So meaning it will not burst, but it will cause combustion if there's a presence of smoke or even connectors. So just to be safe, I already put it outside, no smoking sign. Another thing to note also is just in case if there are children who is roaming here around or playing, please prevent or prohibit them from going near the auto tank, just not to touch any gauge and also not to hang anything. Okay, so first is I'm going to crack the cylinder to check if to enable if there are any leaks for a second. And then once done, I have here a PISS. So when doing this one, I have to double check the O-ring or the washer if it's in good condition, or if there are any leak or loosen attachments. So make sure that when you put this one, it is inserted correctly. And then tighten it. Make sure the flow is in a zero. Then once you're ready, you turn it on. So the doctor ordered 2 liters per minute, so I'm going to set it flow 2 liters. So after that, I'm going to put here a nasal cannula, and I'm going to attach it to your nose. And also another thing is the auto gauge here being said was it's in 1000. So I have to compute it with the duration of the flow. So 1000 and divide it, because it's an E cylinder, divide it with a desired flow of 2 liters per minute. So it will 1000 times with a E cylinder factor of 0.28 divided by with the flow, and then 60. So it will take up almost 2 hours and a half. So once, if another thing to note for you, sir, Mr. Jando, is if ever you notice the gauge, it would reach 500, notify us directly or the nurse station so that we can immediately replace the auto tank. But don't be worried, because as a respiratory therapist, we will time to time do our auto rounds to ensure that the oxygen is in safe and has a safety amount of oxygen. So after doing this, I'm going to assess again the patient, double check, and then make sure the patient is comfortable, and then make sure this oxygen is on the patient's side. And then after that, I have here is a quick connect, which is a for tube. So when you're putting this one, you have to insert it directly to the wall until you hear a click sound, and then try to observe the or check turn on the safety valve